Hi there, my name is Alicia Richter, and today we're going to talk about pelvic floor disorder in the physical wellness class at Bethel University. The first thing we need to answer is what is pelvic floor disorder? Pelvic floor disorder is the inability to control the muscles of your pelvic floor. Some of the symptoms include urinary issues, constipation, lower back pain, pain in the pelvic region, genitals, or rectum, discomfort during sex, pressure in the pelvic region, and muscle spasms in the pelvis. So where is the pelvic floor? The pelvic floor is the muscles and ligaments in the lowest part of your pelvis. It supports your organs like they're laying in a hammock. The pelvic floor prevents these organs from falling down or out of your body. The pelvic floor has more jobs than you think. When your pelvic floor is droopy, it can cause pelvic floor disorder. PFD, or pelvic floor disorder, is caused by weakened pelvic floor muscles or tears in the connective tissue. Because of the weakened muscles and tissue, normal functions are affected in the bowel, bladder, vagina, and rectum. The main causes are childbirth, traumatic injury to the pelvic region, obesity, pelvic surgery, and nerve damage. Your brain controls the muscles in your pelvic floor by way of nerves. There are many things that can cause these nerves not to work as they should, such as diabetes, Parkinson's disease, stroke, back surgery, and spinal stenosis. Like I was saying, the pelvic floor has a lot of functions. The pelvic floor controls more than we think. Its muscles create a sling that holds our organs and gives them support. It also supports us in pregnancy and childbirth, bladder and bowel control, sexual function, passing of urine and feces, and even breathing. So how can I relate to pelvic floor disorder? I selected this topic because I believe I suffer from PFD, as I've had 3 children and fear that my pelvic floor muscles are extremely weakened and not what they should be. All 3 of my kids were born vaginally, and I found out that vaginal births double the risk of PFD compared to cesarean deliveries. This causes me to urinate with sneezing, laughing, or just random with no control over it. I've tried some of the basic ways to fix PFD, but I believe that mine is more than that and I might need medical help to overcome my PFD. I am also Caucasian, who are more likely to develop urine leakage. I am overweight, which puts increased pressure on my bladder, and lack the strength in my pelvic muscles. My diet could also be better and could include more fiber, which also can lead to constipation. Sexual dysfunction is a newer symptom, as the weakened pelvic floor can reduce sexual arousal, infrequent orgasms, and painful intercourse. Emotional stress is the last symptom that I'll mention, as I feel this is something that any mother or any father or anybody can relate to that works full time and goes to school. Not only can I relate to some of the symptoms of PFD, but it also is very important. But why? I want to keep up with my children. My family is the most important thing to me, and because of PFD, it has made it hard to keep up with them when they're active. It has taken a toll on my mental health, as I am constantly concerned about it and my overall well-being. I feel crummy, and I know that there's a reason for it. These are my 3 children, and I really want to be able to keep up with them and run through the woods and go swimming and play. As I said, my family is the most important thing in my life. PFD has stopped me from playing games or being active, as I might have incontinence. I feel pain after sitting at work, and I can't ride a bicycle anymore, as the pressure causes the muscles in my pelvic floor to become too sore. There has to be an answer. So now we learned what pelvic floor disorder is and why it's important. So what can we do about it? The first goal is to make the pelvic floor muscles stronger and to be able to control them, so bowel movements are easier. Kegel exercises is the first step that all doctors will take. These are simple exercises of contracting your pelvic muscles, holding them for 5 to 10 seconds, and releasing. Doing these a few times a day can make a big difference. Medication and self-care are the next steps. Medication can be used to relax the muscles if they are the opposite and too tight. Self-care by reducing strain while using the bathroom, as well as yoga and stretching, can also help your pelvic floor muscles. Warm baths can not only help your muscles, but also the emotional stress component. The last resort is surgery. If PFD is caused by rectal prolapse, then surgery will be used to fix the affected area. Pelvic floor disorder can be embarrassing and painful, but it doesn't have to be. It's highly treatable. Talk to your doctor about what is the right treatment for you, so your life is not affected by the symptoms it causes. I found a verse, Psalm 119, 73-74. You made me, you created me. Now give me the sense to follow your commands. May all who fear you find me in a cause for joy, for I have put my hope in your word. God made us, and he created us just as we are. Pelvic floor disorders, Parkinson's, strokes, bad backs, tall, short, fat, skinny. Let's just love who we are, because that is who God made us. Doctors can help us, and with a little bit of medical intervention, prayer, and help, we can overcome our pelvic floor disorders. Thank you for taking a few moments out of your day to learn about pelvic floor disorders, what they mean, why they're important, and what we can do about them. Here are some additional resources if you'd like to further your knowledge and find out more. Thanks for watching.